Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and if you follow our channel, you know that my passion is cosmetic facial surgery. I love what I do. I love going to work. I love doing facelifts. And thank you so much for watching our channel. We have almost 18 million views at this point. So I want to do a little retro here. You know, fillers are so refined, and there's so many choices, and there's so many uses for them. There's so many great fillers out there. But for those of us who are older, and been doing this a long time, you know, 20 years ago, you didn't have all these fillers. You had really bovine collagen, Zyplast, Zyderm, and you could plump up somebody's lips, but you had to have allergy tests, and it just didn't last very long, and it just wasn't a very positive thing. So lip implants became a relatively popular option, and I did a lot of these. You know, I did several hundred, you know, over probably, I stopped doing them probably over a decade ago. Again, when fillers got so plentiful and so predictable. But lip implants were a good choice, but let me tell you a little bit about the limitations, okay? So I started with Gore-Tex lip implants, and then there was an inflatable implant that got some FDA approval, and then we were using the very stretchable rubber Surgisil silicone implants, and that was really my favorite implant. I think that was the most predictable, and it was a cylinder that was tapered on the ends. It was easy to place. And the good thing about lip implants is that you put them in and they're permanent, right? That's why people want them. It's got that, you know, permanent plumping. It's silicone, which is very safe, solid, biocompatible material. The downside of lip implants is that you can feel them. Okay, there's a little solid tube in there. And in extreme animation, when somebody smiled or pulled their lip back, sometimes you could see the outline of the implant. Even though, you know, that has those potential negatives, I have a ton of people walking around that I did implants on, and I want to take them out, and they won't let me because they really like it, okay? Now, I had a patient come in recently from out of state. It wasn't my patient, but her implant began to poke through her mucosa, as you'll see in the video here. So we're going to take this implant out. Now, this is a Gore-Tex implant, okay? And the Gore-Tex implants are harder to get out, so you'll see me kind of tugging on this. The silicone implants are really easy because they form a thick capsule, and they just literally pull right out. So when you remove these implants, you have to, in this case, the implant presented itself, but generally if somebody wants their implant out, you numb them up, and you've got to make a small incision and find the end of the implant. So if you have a silicone implant, that's easy to take out. If you have a Gore-Tex implant, that's a little harder, as you'll see here. However, it still only takes a couple minutes. When you pull the implant out, there is obviously a little tunnel there, the space that the implant previously occupied, and that'll fill up with blood and reorganize into scar tissue. So your lip will still be a little bigger than it was, but it won't be as big as it was when you had the implant. So really, implants have fallen out of favor, and I don't really think there's any FDA approval at this point now for placement. And a lot of people still want them, but I think that the fillers are better options. So this is a little blast from the past and a little history about lip implants, and thank you so much for your most valuable asset, and that's your time. Thank you for watching. I'm Dr. Joe Niamtu, LoveThatFace.com. So here's a lip implant that is 14 years old, and part of it has started to extrude, and we've anesthetized the patient here with local anesthesia, and we're going to ease this out. And it's a Gore-Tex implant, so those come out. And we got pretty good service out of that implant over 14 years. And that's the nice thing about biocompatible materials, is that easy in, easy out. Hi, I'm Dr. Joe Niamtu, CosmeticSurgeryEducation.com, and whether you're a student or resident studying cosmetic facial surgery, or a beginning practitioner or a seasoned practitioner, we all know that we don't have enough time to learn the latest advances in cosmetic facial surgery. I have my new video series, Volume 2, that is out at CosmeticSurgeryEducation.com, and I have made step-by-step narrated videos in a cookbook fashion that are high definition, and you can preview these and download them from my website, so you own the videos and you can view them 24/7. I have tried to utilize the most common cosmetic facial surgery topics, including but not limited to a brow and forehead lift, eyelid surgery, cheek implants, chin implants, laser resurfacing, chemical peeling, minimally invasive or weekend facelift, comprehensive facelift, mole and lesion removal, and many other topics. If you have an interest in contemporary cosmetic facial surgery and like to see a step-by-step narrated, easy-to-learn version that you can view at your convenience, visit cosmeticsurgeryeducation.com to preview my videos. I'm Dr. Joe Niamtu. Thanks for your time.